Okay, dear professors from Thailand and other countries, and also Chinese expos, I would like to talk about the story about a 25-year experiment journey from hypothesis to clinical evidence. A Chinese paper medicine Tongxinluo and a clinical outcomes patient with acute MI, the CTS-AMI trial. Actually, it is from the protecting both endothelial size and the cardiomyocyte size to prevent from myocardial nerve flow and ischemic reperfusion injury. I have nothing to disclose. And as we know, the reperfusion therapy, the first choice in AMI, because AMI is a leading cause of death in China and as well in the world still now. And the pathogenesis is acute coronary thrombotic occlusion. The first choice is open the occluded artery, including primary PCI and thrombolysis. But coronary dilation is not equally myocardial reperfusion. So because they have the two problems, one, no reperfusion is named no flow, but reperfusion also paradoxical myocardial damage of the heart. So this is also the unmet needs. No treatment, no recommendations for recommendation or treatment of this. Therefore, in hospital mortality or KMI cannot decrease further in the reperfusion era. So it's also affect the survival. So mechanism of myocardial flow is actually a microvascular obstruction. Because of the microvascular ischemic injury, microvascular embolisms, spasm, disruption, and compressed by swollen myocardium. So structure of the myocardial vessels is actually the endothelium surrounded by membrane, so the basal membrane. So essential, endothelium is an essential part of the myocardial microvasculature. So the pharmacology effect of Tongxinluo compound actually is endothelium protection. And so we hypothesize that Tongxinluo may prepare myocardial microvasculature, and then probably prevent from myocardial nerve fall 25 years ago. So the 3 consecutive animal studies with pigs with the coronary ligation reperfusion model and with the international common used methods. So experiment pigs and the important results. We can see that 3 days pre-treatment of Tongxinluo for the pigs, 3 hours coronary ligation, and 1 hour reperfusion. And also with the pre-treatment with the middle dose, like the human dose, 4 pills, 4 capsules per day, 3 times a day, 4 times a time. But the low dose just 1/10. Each day 1.2 capsules, and high dose is 10-fold of the middle dose. That's 120 capsules per day. Okay, we can see from the bar of the red, it's the area of the nerve flow 85. So low dose decreases to 44, and the middle dose and the light dose decreases to 25. And then a myocardial function area from 99 to 89 and then 80. And also the protected microvasculature on electron microscope in infrared area, the swollen, and also normal. So also anti-inflammatory factor for myocardium, dose dependent. Then we just follow joined Professor Wu Yiling, the National 973 project. In this, we did animal studies 7 and a randomized 1. This is a pre-treatment of the last program is a pre-treatment of 3 hours. The bottom is a pre-treatment of 1 hour. So we can see that control the large nerve area, but Tongxinluo decreased, and also myocardial function. But the last column is an enos blocker. enos blocker. So it's exacerbated the Tongxin, abolished the Tongxinluo effects and also and was. And also Tongxinluo activated the PKA enos pathway. In this way, we published this article on American Journal of Physiology. Just behind Professor Jiang published the article. And the Tongxin also anti-inflammatory further confirmed anti-inflammation. Anti-apoptic effects of myocardium is very clear, very significant. And also reduce myocardial permeability and the cardiomyocytes and its mitochondrial edema. So some of the main findings. So Tongxinluo pre-treatment 3 days, 3 hours, 1 hour, just activated the PKA enos and then protect the microvascular and neurofibrous structure function, reduce myocardial nerve flow, nerve perfusion, elevate myocardial permeability, cardiac inflammation, apoptosis, and reduce myocardial infarction. How about the clinical trial? At the first time, at the beginning, I'm scared at the results of the clinical trial. But Professor Wu Yiling said, okay, Professor Yang, you do it. I said, okay, I do it. So STEMI and a loading dose of the Tongxinluo before prime PCI with aspirin and clopidogrel, then just simultaneously, then a daily dose for 6 months. This is a flow chart, design flow chart. Baseline categories are 2 groups of Tongxinluo 108, control group 111. So no difference between the 2 groups. Look at the ST elevation. So after 24 hours of the PCI, the elevation, the magnitude of elevation decreased, significant decrease in Tongxinluo group. And also the Tongxinluo accelerated ST segmental resolution at PCI 6. And finally, the nerve flow phenomenon defined by the ECG ST segmental resolution from 54 decreased to 34, decreased by 36. And also we can see that the low time is expected perfusion scores, both 7 days and 100 days, that showed that the myocardial nerve flow area and the myocardial function decreased significantly. And also the right figure shows that the Tongxinluo is also preserved eject fraction. So the Tongxin clinical effective safe, just the guideline medical therapy plus Tongxinluo for STEMI with primary PCI can promote myocardial perfusion, reduce nerve flow by 36, minimize area of nerve flow and MI, improve eject fraction. So primarily verified efficacy and safety because 6 months of safety. How about direct effect? So Tongxin directly protected cardiomyocardial endothelial cells from ischemic injury. Just at 800 milligram per milliliter, very pure, because of the induced cardiomyocytes endothelial cells autophagy, and also activated the MAC-ERK pathway. So Tongxinluo, we verified that the Tongxinluo directly protects the cardiovascular endothelium from ischemic injury, inhibited apoptosis, induced autophagy, and activated the MAC pathway. How about what's the protective cytokines? We found 4 granular CSF and VGF and angiopoietin 4. We didn't do that. So we have the experiment for the diabetic rats. We found that angiopoietin 4 protected the cardiomyovascular barrier, blood myocardial barrier, by activating PPAR alpha angiopoietin 4 pathway in vivo using diabetic rats and in vitro experiment of hyperglycemia simulating diabetes. Here we can find the bottom left, we can see Tongxinluo 800 per milliliter can decrease the permeability of the hyglycemia. And the middle one, bottom middle one, Tongxinluo equal to insulin angiopoietin 4 and blocked by the PPAR alpha blocker. And bottom right, we can see that the small interference of the angiopoietin 4 also abolish Tongxinluo's effects. Okay, the bottom left, bottom right also directly Tongxinluo enhance PPAR alpha activity and abolished by the blocker. Okay, how about the permanent ligation of coronary artery of the results? Same. So it's activated the AMPK-mTOR pathway. Next question. For ischemic reperfusion injury, Tongxinluo can directly prevent from cardiomyocyte apoptosis? Yes. It's actually 400 milligram per milliliter. And also, directly protected ischemic stress myocardium via microRNA 128-3P, P76S61K pathway. Interesting, for the rider, upper rider, the transwell is a ischemic reperfusion, the reperfusion environment. The bottom is the endothelium. The upper level is the myocardium. We can see that after if we reperfusion injury, the control says that the endothelium size apoptosis very severe. But if we use Tongxinluo pretreated myocardium, myocardial size, co-culture with the endothelium can protect the myocardium. And also abolishes the small extracellular vesicles, so abolishes the protective effects. But we directly give the Tongxinluo pretreated cardiomyocytes derived extracellular vesicles, the cardiomyocyte endothelium also can be protected. So in this, we can see that Tongxinluo directly protect the myocardium, and then the small vesicle vesicles just inform endothelium. Just endothelium said, okay, no good. You should protect yourself. The endothelium responds as, okay, I will microRNA 145 decreased, then activated P-enos, so protect themselves, and then intensify, protect the myocardium again. So clinical implications for all patients with STEMI, but evidence-based medicine is needed to evaluate the clinical efficacy and Tongxinluo for STEMI, like Professor Academician Jiang has already summarized. So this is it's our great pleasure. Actually, Professor Jia Zhenghua have the national key and reading project 2017. So we studied China Tongxinluo study of myocardium protecting patients with acute myocardial CTS-AMI trial, started on 2019 before COVID-19. January, the start time is in Beijing. This is actually Professor Gao and Professor Peterson from the United States, me and Yao Chen is a statistician. Kickoff. And at that time, another year, 2019, May 2019, we enrolled first cases. 1.5 years later, we completed enrollment at 3,707. And follow up 1 year, and another 5 year, half year, the data entry, and also following the boundary review and unblinding, and the next statistics. So fortunately, we have published in not published, talked in invited talked in the AHA 2002 on the main session of liver science. High impact trial. Also factually in the same year, within the year thereafter, we published this in JAMA. This is a population. This is a flow chart. That's a randomization grouping, and then give the patients do anti-plaque therapy and the Tongxinluo or placebo. Then follow up and use 1 year. So this is a baseline characteristics, no difference, no difference. Baseline, no difference, no difference. Primary point, 30-day. 30-day MACC, just death, MI, revascularization, and a stroke. Decreased from 52 to 34. It's decreasing by 36%, especially including mainly due to the 30% cardiac death, cardiovascular death, significantly. Also, no increasing of the stroke. A couple of 1 year, also 1 year, 30-day decrease of MACC, yes, by 36, including 27 death increase. And also, right side, the figures show that we have the landmark analysis. So within 1 year, from one month to 12 months, further decreased 35. So continue effective. How about the 30 severe STEMI complications? The risk decreased 20%, including 23% of malignant arrhythmias. And also the sub-analysis also effective, especially no reperfusion therapy, also effective. So the editorial from JAMA, from Dr. Patch, said, okay, traditional medicine meets evidence medicine in the acute infant heart. So summary of the Professor Patch's editorial. STEMI outcome has improved due to evidence-based medicine in the past 40 years. But however, no breaking through in drugs for the last decade, even in this hyperfusion era. CTS-AMI is the first large randomized double-blind placebo-controlled multi-center trial which meets the evidence-based medicine. So could improve clinical outcomes for both 30 and 1 year MACCs. Next, just suggest that we confirm further in the Western world, important active ingredients and so on. Okay, so clinical benefits of Tongxinluo can be summarized like this: reduce 30 MACC 36, cardiac death 30%, severe complications 20%, malignant arrhythmia 23%, 1 year MACC 36%, cardiac death 27%, re-MI 74%, stroke 56%. This is a very exciting results, and doubted by Professor Zhang at the University. He also asked online, said, okay, what's about the stroke? We said, okay, decreased 56%. So interesting. Rehospitalization to heart failure decreased 52%, or cosmetic decreased 23%, but insignificant. So slightly more adverse drug effects, just gastrointestinal symptom 2.1 versus 1.1. Significance. This actually is the original research on Tongxinluo compound, first published on the one top of the journals. First effective drug for myocardial nerve flow and ischemic reperfusion injury by dual protection of both endothelial size and cardiomyocytes. Of the first drug that can improve clinical outcomes for STEM patients in the reperfusion era. A paradigm for CTM evidence-based medicine, a big step for CTS internalization, a good way for integrating or emerging CTM in modern healthcare. Actually, this integrating, I disagree. This afternoon I will talk about that. Integrating or emerging TCM in modern science, that means it let him join to modern science. I think it should combining traditional medicine with modern science. A drug also treating coronary artery Professor Zheng, and the stabilizer plaques Professor Zhang also ready to do this. Okay, the implications of STEMI, all STEM patients, all discharged STEM patients, for all with angina pectoris, for all patients with atherosclerosis. Okay, the consensus in China have many recommendations for all patients with acute MI both STEMI and non-STEMI, both underwent primary F and PCI or not, both in hospital or discharged, both have ischemic symptoms or not, both have remaining coronary atherosclerotic lesions or not. For all types of angina pulmonary with stable, unstable, spontaneous, or principal variant and microvasculature. For all coronary heart disease after PCI, both incomplete and complete vasculature. For all coronary heart disease with heart failure, old age, ischemic stroke, and carotid artery atherosclerotic disease. Acknowledgement, funding from National Science Foundation of China, and also develop research at the national development and the national R&D foundation. A special thanks to Professor Peterson and Xian Ying, study design, conducting data, interpretation, and paper, all the way to give us help. Okay, thank you very much. That's all. Thank you.
Thank you very much, Professor Yang Yue Jim. Professor Yang summarized his basic and clinical studies on the role of Tongxinluo in acute myocardial infarction for the last more than 20 years. The study CTS-AMI led by Professor Yang reviewed good results, which showed that in addition to the guideline-directed medical treatment, Tongxinluo capsule significantly improved the clinical outcome of patients with acute myocardial infarction. Tongxinluo reduced the major cardiovascular events by more than 1/3, that is 36% by the end of 30 days, and also reduced cardiovascular events risk by 36% by the end of 1 year. This trial has attracted high international attention and showed a good promise for the future of traditional Chinese medicine. CTS-AMI set a good example for the integration of traditional medicine and modern RCTs. We thank Professor Yang for his continuous efforts in the study of Tongxinluo for more than 20 years, and also congratulate him on his great success. Thank you very much.